Oh, it's been a rushed, busy week, but I
Yes.
didn't expect to be dealing with this today.
So, tell me, what are your thoughts on all of this?
What are my thoughts on all of this? I think it's shocking. Just yesterday, I happened to be, or on Wednesday, in a press conference with Dr. Bob Lutz, answering questions from the media about the raising case numbers in our county and going into the fall season, the surge season of the pandemic front. And then 2 days later, to hear that he's been asked to resign is, it's a blindsided attack on frontline public health workers who have given this pandemic their all to try to serve our community's health needs. And it's just senseless. It was not. There was no question about his integrity or the quality of his leadership. He just won an award for the clear direction he's provided to our county in battling this virus. And it's really hard to see it as anything other than politically motivated. Um, trying certain interests trying to prioritize economic concerns over public health concerns. And so it's really demoralizing and infuriating to have this kind of a move sprung on the community at this kind of a time, in this kind of a way.
So, how long have you worked with Dr. Bob Lutz?
I worked at the health district for about 3 years in what was then known as the health promotion division. So for about a year of that time I was under his leadership.
And you are now an epidemiologist. Do you still work for the district, or what is your title now?
Um, I'm a community organizer, so I haven't been with the health district for the last few years. I work in an independent business association.
And during your time when you were working with Dr. Lutz, was there ever, I know you said you were blindsided, but was there ever a time where you felt like, okay, you feel that there's something kind of weird going on, like there's, sort of hints that this would happen? Or, I mean,
No, he's a straight up guy. He says what he means. He's very rational and steady and logical and predictable and dependable. And he's a man of science who has held the line on all kinds of wild ideas about how the pandemic is or isn't spreading in the community. He really is just a straight up leader that's dedicated to serving public health. And that's why he was selected for this position, is because of his medical expertise. And to now be asked to step back because his medical expertise isn't economically convenient is something we really need to grapple with as a community, and something I don't think the community is going to stand for. People are concerned about losing loved ones right now, and they know that Dr. Bob Lutz has done everything in his power to keep case numbers low and to fight this virus strategically and effectively, based on best practices. And they don't want to have an interruption in leadership in this critical moment, right when we're going into a fall spike of cases.
have you talked to him since today or this morning?
Now, the last time I talked to him was on Wednesday, and there did not seem to be any concern about a change in leadership. It really is out of nowhere.
And I guess the last two questions here, what is your biggest concern about this new, looks like Amelia Clark, who is going to, she's going to bring forth and sort of take over? I mean, what is your biggest concern with that sort of new change in leadership there?
She's been the administrator for the last few years, and I haven't worked under her personally, but I know she has made some other dramatic and quick decisions about changes in leadership that were pretty uncalled for from a staff perspective. People who'd served the agency well for over decades, all of a sudden were no longer in her good graces. And there's been quite a lot of shakeups. And so this seems to be, the only thing that makes this not surprising is that it's in keeping with that pattern. But having it go to the highest level at this time, and it is really uncalled for. And so it's like, is this the commissioners asking Amelia to ask Dr. Lutz to step down, or is this Amelia having unarticulated grievances and making an executive decision that is harmful to the agency and the purposes of public health in our community in this moment? It's hard to say because she won't tell us. There's not a clear rationale for a dramatic change in course at this time. It's just everyone is left frustrated. I think she needs to look at what this does to staff morale. You know, these public servants who are on the front lines, who've had the worst year of their professional lives, giving this pandemic response their all, to have the rug pulled out from underneath them. You know, they knew Dr. Lutz was a man of science and reason who wasn't going to compromise on public health, and to have him asked to step aside, it's really out of touch with what the people who are running our response need right now and what our community needs from them.
And then just last question here is if there was a message that you'd like to send to Dr. Lutz today.
You know, he is such a self-effacing leader. He knows not to take these things personally. He understands the economic fallout that this pandemic has caused. And he really believes the best way we can get our economy back on track is by following public health orders to wash hands and maintain distances and maintain isolation. That's how we slow the spread of the virus, and we can reopen our economy to its previous functioning. So I don't need to give him words of encouragement because he's a strong leader who knows in his heart of heart what is right by the community. So I would just encourage him to continue his trajectory of service that's been acknowledged with recognition and awards. I don't want him to step back. I don't want him to step down. I think the leadership who requested this needs to answer for why they're making such a dramatic request in such a sensitive moment. They can't mince words and give us non-answers unless there's something we don't know about Dr. Bob Lutz. This is really uncalled for.
Yeah, and from what I've been hearing is that everything's been very vague on their end to sort of explain what's going on. So
they don't want to own up to what this is really about, which the community suspects is prioritizing money over people's lives, and that's not okay. So, and if that's really what their agenda is, then they need to come out and say it. And they need to try to make a science-backed argument for why the economic fallout is having a bigger health impact than the virus's health impact. But that's not really the commissioner's area of expertise. And so if Amelia has something to bring to that argument, we need to hear it outright. She needs to actually lead and explain this move. And if the move is unjustified, then let's not heed it and let's continue fighting this pandemic together.
All right, Mariah, anything else you'd like to share?
I think all of us, there's like a National Hug a Teacher Day. There's very few public health workers in our community. Public health has been underinvested in for decades prior to this pandemic. We used to have a lab at SRHD that could have helped us in this effort, but it was cut due to austerity and budget cuts and other priorities that now look short-sighted. So if you know someone who works in public health or a community member who is volunteering their time to help with pandemic response efforts, thank them. Because if this virus has taught us anything, it's that we are all connected. And so those who are on the front lines need the community to support their work. And that requires a strong leader that we've had in Dr. Bob Lutz. So give the frontline public health workers your encouragement and support in this issue.